Risperidone, brand name Risperdal, is an atypical antipsychotic drug that is used to treat mental and mood disorders, such as schizophrenia, bipolar disorder, and irritability associated with autism. It works by blocking the action of dopamine and serotonin, two neurotransmitters in the brain that play a role in regulating mood, behavior, and thought. The starting dose of risperidone for adults with schizophrenia is typically 1 to 2 mg per day, with a maximum dose of 16 mg per day. Doses may be adjusted based on the patient's response and tolerance to the drug. The recommended laboratory tests before starting risperidone include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. Like all antipsychotic drugs, risperidone can cause side effects, including drowsiness, weight gain, dizziness, headache, hypotension, dystonia, akathisia, hyperprolactinemia, dyslipidemia, drug-induced Parkinsonism, tardive dyskinesia, nausea, vomiting, and abdominal pain. In some patients, risperidone can also cause more serious side effects, such as increased heart rate, increased risk of diabetes, and increased risk of developing blood clots. Risperidone is contraindicated in patients with a history of allergies or hypersensitivity to the drug, and in patients with certain medical conditions, such as liver or kidney disease. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with risperidone.